Well, hello and welcome to the Truths of Transformation to Envera Health webinar, where we're going to be joined today by outside industry experts, and we're going to hear some great information from them about the truths of transformation and some experiences that they've gone through in other industries and what that has done to transform their industries and how it can be applied to healthcare. So welcome today. We're excited to share this with everybody. We're excited to have you a part of this experience with us. Again, we believe here at Envera Health that providers are especially positioned to bring transformation to the healthcare experience and to bring it to consumers. The consumers that we are interacting with on a day-to-day basis are seeing most other industries really reacting to their desires and their needs and really transforming the industries to be more attentive to them, to be more personalized, and to be more receptive and responsive to their needs. We know that all of our provider partners are desperately also trying to react to consumers' desires and create a more consumer-oriented experience for them as well. And we're excited to work with our provider partners in helping bring that type of transformation to their consumers. We also believe that no one can create transformation by themselves and that we need to have experiences that we can share and learn from all industries across all segments. So bringing outside experts in is something that we are very excited and do often here at Envera, and we want to share their experiences with our partners and providers and want them to teach and learn and help us grow and help our consumers generate a better, more satisfied experience in healthcare. We also want to bring those experts to our organization full-time. So here at Envera, we also pride ourselves at bringing expertise from other industries and being a part of our team and offering those folks to all of our provider partners on a regular, ongoing basis. So they have access to learnings and transformation from other industries constantly. So with that, that is what today is all about. And the first partner and wonderful partner of ours is James Warren from Share More Stories. James will also be helping us facilitate this conversation today with our expert panel, but brings a lot of great storytelling and a lot of great experience himself from several of the organizations he's been working with throughout their careers. So I'm excited to introduce you to James Warren. Thank you all for taking time out of your busy days to participate, and we hope that you get a lot out of this conversation. And with that, I introduce you to James.
Good afternoon, everyone. It's so great to be part of this conversation with you all. As Erin mentioned, we've been engaged in really exploring what the future of healthcare looks like, what the transformation looks like, and really what the stories are that underpin that transformative experience. And so we're really happy to sort of reprise some of the conversation we had last May and June, where we really brought together a number of folks in the Truth Lab experience to explore those stories of transformation. And one of the first stories we want to bring back to life, if you will, is the story of transformation at CVS. And to have that conversation with us, joining us is Dr. Nancy Gagliano, who recently served as a senior vice president at CVS Health in the role of chief medical officer for CVS Minute Clinic. She really led the transformation to consumer-oriented healthcare, both at CVS, and she's been doing it really throughout her entire career. So she's going to share with us some highlights really from that transformation at CVS that we talked about a few months ago. So Nancy, welcome to the conversation.
Thank you very much, and hello everybody. It's great to be here.
Good to see you again.
Good to see you too, James.
So one thing I want to do to kind of dive right back into the conversation is when we met last June, we had a really great, fascinating conversation around what transformation looks like at scale. And you shared a story about a big transformation at CVS that was really sort of characterized by a big bet, maybe a $2 billion bet. So would you tell our audience a little bit more what that experience was like for you?
Sure. So as the chief medical officer for Minute Clinic, one of the challenges that we found was the fact that we were providing healthcare within CVS's pharmacies, but we continued to get pushback the fact that we were selling cigarettes, and there's not any amount of cigarettes that is good for you. CVS was thinking about transforming into the future and really becoming a healthcare partner within the community, right out there with the community, and realized that having cigarettes and selling tobacco was really not congruent with being a healthcare organization. However, as James said, we were selling $2 billion worth of cigarettes every single year. And that is a lot of money, pays for a lot of infrastructure. So we realized that unless we got rid of cigarettes, we really couldn't call ourselves a healthcare company. And the big bet was, a bold, audacious goal. If you're going to get rid of $2 billion, what are you going to replace it with? And is that the benefit to your reputation going to make up for it or not? So it was a really big, bold decision. But once we made it within the organization, from the leadership down, everybody really got engaged in it.
That's terrific. Thank you so much for sharing that perspective, because it really frames what transformation looks like, especially when you're making those kind of really big strategic decisions. Now, maybe let's shift the conversation a little bit and talk a little bit more about your experiences at CVS more generally and how they really shaped your understanding of the need for consumer-centric healthcare, really putting the consumer first, putting the patient first.
Yeah, so thanks, James, because that is definitely a big transition. So I had spent 21 years at Mass General as a primary care provider and a senior executive there. And as you know, the world today, all healthcare systems are talking about consumerism, putting the patient first. Typically, healthcare systems have always put the provider first, the physician first. And it really wasn't until I got to CVS and MinuteClinic where we really did put the patient first. We flipped healthcare on its head, which means we brought healthcare out into the community, right at the pharmacy. We were open evenings and weekends and holidays. So we were open on Christmas and New Year's Day and Thanksgiving, when people still get sick. We were transparent with our prices. So we really took the lens of what the consumer wants and we built it around that. And guess what? Our patient satisfaction scores were phenomenal. Once you really put them first, it makes a huge, huge difference.
So I suspect having the expertise and the capability, and to your point, the infrastructure of having so many retail locations, thousands of locations across the country, really, you already had a sensibility of putting the consumer first, because that's what you needed to do to operate the core business, right?
Right, exactly. So, and that's what, in the retail world is so used to putting their consumer first, really understanding their consumer, doing a lot of market research and not just guessing what their consumer wants and trying to fit it in, but really building around the consumer and providing products that the consumers want. And they definitely wanted MinuteClinic.
So, and I think maybe that's the last thing I'm really curious about from that whole transformation experience. When you opened up MinuteClinic, you also entered a new phase of competitors and partners. And so tell us what that's like for you, and what's your perspective on partnership versus competition as you go through a process of transformation like this?
So as you can imagine, here was MinuteClinic within a CVS offering healthcare. You can imagine that the typical provider health system in the community wasn't thrilled about us. And one of the things that my role was to go out and partner with our local health systems and really get to have them understand the services we delivered and how we could partner. And for some organizations, they looked at us completely as if we were competition. We were stealing their patients away. Other organizations said, hey, it's great you can provide low cost, high quality care evenings and weekends. Let's be partners. We'll take care of the sick ones that you see, and you'll provide access to our patients when they need it and when it's convenient for them. And over the course of time, I would say we shifted much more into partnership relationships and did veer away from the competitiveness. But I think that's a reality today in anything we do, is really looking at both sides and trying to have a conversation of where together you can really add value and avoid being competitors, but really work together to create something bigger and better.
Yeah, I recall from our conversations last year that so much of our ideation and our brainstorming really explored this space of how might organizations partner together, because there are so many touch points across the entire healthcare experience. And we know that, in other industries, they've gone through a lot of work from a digital transformation standpoint to really sort of fix the back end, and in some cases the front end of that experience, but it hasn't always translated into a better sort of human experience for the consumer. And so it strikes me that partnership opportunity really helps us sort of unify that experience, unify engagement for the patient across all those different touch points. Is that kind of what you've seen in some of your work since
Right,
CVS?
absolutely. And for an example, at CVS, the typical patient who has diabetes who comes and uses CVS comes to a CVS about 8 times a month, where they might see their physician only once every 3 months. So if you look at it that way and can think of, we have a tremendous challenge with diabetes in the country. And if you can think of it, wow, let's partner together, we can accomplish so much more, as opposed to where we are in typical healthcare, which is hold on to the patient and think of the patient as an asset, as opposed to what in the community we can do.
Right. Well, that's really well said. And one of the things that I think Erin shared at the beginning of the conversation was to figure out what those partnerships look like, to figure out what those pathways might look like. Sometimes you need to bring the outside in and really broaden our perspective. And actually, I want to do that now in this conversation. I want to broaden the conversation and invite some of our other guests to the panel. And I'm also going to invite one of my colleagues, Jen Pike, who works with us at Share More Stories as well. And she's going to steer a little bit of the conversation and really continue this dialogue of what does transformation look like in some of these other industries that might enable us to learn, just like we have from your industry from a retail perspective.
Hi, everybody. So we've got Amy and Carrie and myself joining the conversation. I'm going to do a quick just introduction beyond the title that you have on the slide that everybody's looking at. Carrie joined Yext as the company's first head of industry for healthcare. In her role, she uses her passion around intersecting healthcare and technology to lead all healthcare-related activities, including product and partnership development. So we're going to be talking a lot about technology and partnerships with Carrie today. And then Amy is the Director of Client Services at Go-Kart Labs and has spent the last 20 years discovering, creating, and building disruptive and enlightening digital consumer experiences and products with tech startups, Fortune 100 companies, and innovation and growth labs. So I also know that Amy has quite a bit of experience recently in both healthcare and financial services. So when we think about inside out and consumer-centered and how we can reimagine things, these are two wonderful women to have in that conversation. So Carrie, I'm going to start with you, because I know when we first met, I personally was very excited to, in real life, meet somebody who had worked at Google. a real Google person on the East Coast. Tell us a little bit from your point of view, if Google or Amazon were to step in and start kind of taking over healthcare, what do you think those sort of digital native companies, what would they be doing that is most different from what's happening in healthcare today?
Good question. I feel like I talk a lot about this with all of the different health systems that I talk to across the country. They are shaking in their boots because CVS, Nancy, and Amazon and Google and Apple are all getting into their space, and they're very, very scared. And I would have to say, I mean, Nancy touched upon it earlier, I would have to say is these organizations have such an understanding of their customer journey, and they have a critical understanding of the data behind the scenes, of segments and understanding of what customer needs what and when. And when I think about the 300 health systems I've talked to over the last 2.5 years, there's probably only one or two who can even get to the point where they partially understand that full patient journey, or now what we're starting to hear a lot of is the consumer journey, and they don't have a grasp of the data. And the data is what is going to win at the end of the day. CVS totally won on the data, wouldn't you say, Nancy? They understood the value of every single micro segment and where the customer was and what it actually looked like to be in the neighborhood. And I love that stat that you had about the diabetes patient going into the CVS 8 times versus seeing their primary care provider or their endocrinologist maybe 3 times in 3 months. That's huge data, and health systems don't have that today. So the data behind the scenes, I think, is a huge, huge, huge piece. The second piece is they have a really fundamental understanding of search and discovery. And people are searching very differently today than they did even 2 years ago. And so I bring my Google experience back. I spent 8.5 years there. I've been talking about the online patient journey for over 12 years now. And I can tell you for a fact that people are not looking for a doctor near me anymore. They are now searching via complex queries. They're looking for a doctor who is a cardiologist, who treats mitral valve repair, who accepts Cigna insurance, who's located within 4 miles of where I live, who's rated 4 stars or above. What health system today can answer that question? But Google can certainly go out and find somebody who might be able to answer it. Amazon has the data of what's now being asked because they have Alexa in 75% of all homes. And at the end of all of it, they are the ones who innovate so much more quickly than health systems do. So they will tackle this problem, they will understand this problem, and they will get out in front of it before any health system will ever be able to address it. So just being able to understand search and understand the data, I think those are big, big things that present big threats to healthcare today. But also very exciting. I don't want to be a Debbie Downer, but it's very exciting, and it's going to fundamentally change things and transform things. But health systems, I think, are really quaking. They're shaking in their...
I'm going to actually, Nancy, I'm going to loop back to you for just a second, because now I'm so curious. So you lived in the world of CVS, of data, of patient data.
Oh, yes.
And I'm hearing Carrie say health systems just don't even have it, and they don't, which sort of surprises me, because when I go anywhere to get health care, I am filling out a gazillion forms or answering the same. I feel like they have my data 6 different times. They have so much data.
And it's probably on paper.
It's all on paper. That's it. They have it on paper. They haven't figured out how to mine the data. They don't even understand that they should be mining the data. So we knew a lot about the typical patient who came to Minute Clinic, we had buckets of patients and buckets of consumers who spent a lot of money, who didn't spend a lot of money, what their desires were, lots of market research. Having been at Mass General, I know it's now a while ago, this was just a tip of the iceberg, and a lot of the data that health systems focus on is very much quality. What illness, what's the illness burden, which is important, but looking at them as patients, not consumers.
That's true. And then back to what Nancy was saying earlier too, about how health systems tend to listen to the provider or be very provider focused. CVS, Amazon, Google, Apple, they're super consumer focused. And until systems can make that pivot so that they truly are patient or consumer focused, as long as they're focused on that provider, there's not going to be that emphasis on the data and understanding those segments and where the revenue can be driven as a result of those understandings. So it's a big uphill battle, I think.
Can I tell one quick story? Yeah. So when I was at Mass General, we were having problems in our parking lot because there weren't enough parking spaces. And what did we find? That our parking lot was packed on Tuesdays and Thursdays. And it was packed because on Tuesdays and Thursdays, when you took 2,000 physicians and you spread across when they wanted to see patients, there was a peak on Tuesdays and Thursdays. Some people wanted a long weekend on Mondays. Some people wanted to get out early on Fridays. Some people wanted to do administrative time on Wednesdays. Let me tell you, the docs at Mass General work really, really hard. This isn't about them not working. It's just they wanted to see patients when they wanted to, as opposed to the fact that Monday through Friday, and guess what? Mondays and Fridays are really big days that patients want to be seen.
Yeah. So Amy, I'm dying to get you in on this, and especially in your work in financial services as well, because just the whole banking hours, I know how much technology has really changed my relationship with my bank, right? And what you just described, Nancy, in terms of physician hours, it seems like they're still old bankers. Like, what are you kidding that I have to get an appointment between 9 and 5 on Monday and Thursday and Friday? Like, nuts. So what's your perspective as you listen to this, Amy? What are some things that maybe are similarities between financial services that might be another area of ideas for healthcare, perhaps?
Yep. Well, I'm interested in everything that Carrie was saying about the health systems, and it's so true, and it's such an exciting time, right? As to when are these big health systems going to forge those relationships with the Amazon and Googles, rather than like constantly think like it's better to incubate ourselves? Is there a larger partnership? This is just, my husband's in healthcare. This is one of the things that we talk about a lot. But when we look at it for financial services, believe it or not, of like the three largest constrained consumer-facing industries in the U.S., healthcare, financial services, and education, believe it or not, financial services is the lucky one that says that they're the most out in front. And it's only because of the company they keep. And I think a lot of big banks will tell you this. A lot of big banks are heralded as great technology data miners and whatnot, but they're still trying to figure out what to do with this data. And if you're not like maybe a top 5, you're behind. And the same exists in insurance. So a lot of the focus recently has been, okay, financial planning, financial savings. It is very much like a healthy lifestyle, if you think about it. There's this whole talk over the last maybe 3 to 4 years about financial wellness. And that used to be like, well, if you had enough personal wealth, I was meeting with my financial advisor regularly, and she or he was guiding me and check the box for the year, move on. Now it's more at our fingertips because of technology and the data that can be sent right to our phones. But at what cadence can we thoughtfully engage with it to feel like we're making a difference for ourselves? And I think that's the next nut to be cracked. All this data exists. We are constantly creating up hypotheses about how to better serve consumers through digital products, digital interface. But how do we meet them not only where they're at, but where they want to be tomorrow, so they want to come back and engage with us over those digital mediums? And it's not all digital either. There are some human components like that. Just like in healthcare, it's proven time and time again, when you have accountabilities to a coach, a group, a friend, something, you're going to do it better. How can financial services create that same sort of engagement with digital leading it, because we can touch more people's lives over digital means than one advisor, one person at a time, but still have a human component to be like, you're not at it alone. I'm here for you to help you understand something, or to get you to contribute 7% to 8%, because over 25 years, here's the difference it's going to make in your lives, your partner's lives, your children's lives, whatever your life may look like. And those are those little types of nudge behaviors that we as product people in the digital space are really starting to study. Because when you can get nudge behavior done in a very authentic, customer-driven way, customers will respond, and they'll start to make those healthier, long-lasting changes, just like we all had to do maybe as we age to cut the carbs a little bit, but we've noticed that our pants fit better. So it's the same thing with financial wellness, right?
Well, let me ask you guys, because when Amy says that, immediately my mind goes to, if I think about things that are helping me stay healthy, honestly, the doctors and physicians and those kinds of folks don't come to mind, because that's who I see when I'm sick. When I think about who's keeping me healthy, it's the step tracker that I can't even now turn off from my phone, because that's telling me I have too much screen time, so I should just back off and go for a walk. Mm-hmm. What do you, Nancy, well, for any three of you, are you seeing anybody in the more traditional healthcare space starting to think about designing themselves to keeping people healthy versus treating them when they're sick? And I know, Nancy, like, this was one of the things you said, and I was like, oh my gosh, that's like such a brilliant idea. But is anybody doing it in traditional healthcare?
So I definitely, and I know Carrie will jump in here too, I definitely know that healthcare in general is making that transition to focus more from taking care of the acute ill to let's focus much more on wellness prevention, which I think is phenomenal. We definitely as a country need to go there. Having said that, I think we need to be a little bit careful in that, it takes 8 years to become a physician. And I'm not sure you need to be thinking that the MD is, in the long run, the best person to be helping somebody exercise and eat healthy. I look at this as we need to really focus much more on community-based, team-based healthcare and having the right people create that entire infrastructure so that it's not just I go see my physician every once in a while and everything is taken care of by that physician. It's like, let's make sure people are trained right, and we think much more broadly about healthcare and how many people it takes to really provide health in this country.
Nancy, that really speaks to the partnership aspect that you talked about a little bit earlier. Like, what are those, what does that whole ecosystem look like if it's not the role necessarily of the primary care physician to do all the things that we need to do day in, day out to stay well? Mm-hmm. Then, for any of you, what might those partnership models look like? What might those other roles be in that overall delivery of both care and wellness?
I have actually seen this start to come up in a couple of different organizations, and I look at partnerships in two different ways. I look at partnerships with external organizations, and then I also think of partnerships within an organization. And so the biggest transformation that I've seen in one organization is actually internal. And I can speak to Ohio Health and how they've thought about, for example, their marketing team and how building their marketing team to really touch the consumer. They don't even say patient anymore, they say consumer. They've taken their marketing team and they've added a dev team to it. So now their marketing team includes developers. So if they want to get something done that is more technologically focused, they have developers right there on the team. They run agile. They do everything that basically a tech company would do to release things. And what we've seen is that they're focused far more on wellness and developing wellness tech so that in an ultimate scenario, they could even, this might sound a little bit creepy, but think about how this could change things. They would like to know that somebody has their phone. They have maybe the Ohio Health app on their phone. They go to a Starbucks and they know that based on the GPS they're at that Starbucks, they can ping and say to that patient or consumer, hey, this latte is better than this Frappuccino. Make a healthy choice. That's a really interesting thing where they're actually being proactive, and there's literally nothing to do with a provider in that scenario. I was just at Envera Health earlier this morning here in Boston, and they have a really unique setup as well, where it's not just provider focused. They have a team and they have health coaches on the team. So patients and consumers are now not just going to see a doctor, they're going to see a team of individuals. And then finally, I think there's also this whole concept of people are not discriminating anymore. When they need care, when they need something, when they have an intent, they're looking for something online. I go right back to Google again. They're just looking to have something solved in the moment. So if you can get the right information from one provider who might have an MD or an online blog or your app or technology or whatever it is, it's just if you can get it solved and you can get it solved easily, you develop loyalty that way, as opposed to the traditional sense of marketing where you would develop loyalty in a traditional funnel.
Amy, you want to chime in?
No, I'm really excited about that Ohio Health case study. I'm going to dive into that.
It's really great.
That makes as a product person, that makes perfect sense. That's awesome. And I'm from Ohio.
I've only seen a few. Jefferson Health does it as well. They have an entire innovation team. It's called DICE. But there are very few health systems that are doing this. But I think that's really where healthcare organizations need to go. They need to have tech and marketing in cooperating together to really move the needle on focusing on wellness as opposed to solely patient acquisition.
Right. Because that consumer knowledge or that psychology of consumer. It just doesn't live in one little part of an organization. It lives throughout. And yeah, bringing together those teams, the tech, the marketing, and in our industries, you got to bring in compliance early too, right? So we make sure we're by the right side of the law, but where are the boundaries to push on to get closer to that consumer?
That is so true.
Yeah.
Well, and the other thing you mentioned, Carrie, which I think is really important, is the concept of patient loyalty. I think gone are the days where once you acquire a patient into a health system, you have them for life.
Right.
Definitely not.
It's still the older population that has the stronger loyalty, but the younger population, as you're implying, are actually loyal to whoever solves their problem when they need it solved, and they don't think of needing to be loyal to one organization.
No, I mean, think about searching on Amazon. It is so easy to find a product on Amazon, to look at the ratings on Amazon to see how much the product costs, to look at all of the description of the product, to even do comparisons, and then to click buy. And if you're a Prime member, receive it within 2 hours if you're in a big city, or 24 hours. It is so easy to do that, and everyone now is doing that. They're trained. And then when it comes time to figuring out your healthcare and getting some sort of question solved, or trying to book an appointment, or just understanding what might be wrong, it is so complex. And so whoever can simplify that and make it easier so that it's more like Amazon, or more like something that's a lot easier than what they have now, they will win in the long run.
I agree, but I also want to push a little bit, and this is like going back to the conversation that we had a few months ago, because one of you brought up that another missed opportunity right now, and I'm wondering if this combination of if we thought about providing services for healthy people to keep them healthier, and getting them the answer they needed when they needed it and how they needed it, could health systems develop deeper loyalty earlier with a millennial population, or soon to be, because now even Gen Z is older than I like to think that they are, so there are some young adults in that population as well. Because I do believe as much information is out there, I am just a believer in loyalty and brand loyalty and I just love that stuff, and I believe that it's true. I think what happens is a lot of times nobody is bothering to build the right kind of relationship for you, particularly in healthcare, until either you're in crisis or you're much older. You just, maybe until you have your first baby. I think until I had my first baby, I don't think I'd been in a hospital since I had to get stitches in my face at a soccer game in high school. I mean, that was like, that was 20 years. Well, maybe not that long, but several years, too many years for me to be not engaging in a health system, and my doctor changed whenever I moved, which was a lot because I was in my 20s and living it up. So, that's why I want to push, because when I hear you, Carrie, a little bit of me wants to like lose hope that you could build relationship, not in a bad way, but that you could build relationships over time. That if I'm a big organization who does want to foster a relationship over time, do I have to fold my cards and say, you know what? Like, I might have to embrace and partner with Google on this because they're just going to beat me in the Apple Watch on that. I mean, what do you guys think? Do I have to hang it up as a brand loyal kind of believer when I'm thinking about the healthcare space?
So I can take a stab at that. I think you do. Hang it up. I'm going to say it out there. So what I think is, why do we go to Google, and largely, and only 10% of the people who are searching, why do they go to Bing? It's because Google gives better answers. Why do we not go to Alta Vista? Why do we not go to Lycos? Why do we not go to AOL search when it was like, why do we not do that? Because people kept going to Google because they got better answers. They got their questions answered. They kept going back. And when I was at Google, Google was always saying, we won't let you know what our natural search algorithm is because we don't want people gaming the system. But we want to develop something that is so good that people will return to it. And I think we need to, at least in healthcare, think about the traditional concept of brand and brand loyalty, flip it on its head, and think about basically Google and why people even buy Apple devices. Apple devices are so slick. They're so easy to use. Everything about it is really, really, really fine. And if healthcare organizations can get to that point where they do become easy, people will opt. I don't have any data to prove this, but I really do think that people will opt for something that is easy. People didn't know about Google in 1998, but it started to spread because people were getting the answers. It's the same thing, I think, within healthcare, is that when something becomes easy and other people now start talking about, wow, this is really easy, more and more people will start to migrate in that direction. So the concept of brand loyalty, because I'm loyal to MGH, or I'm loyal to Partners, or I'm loyal to Dignity Health, or I'm loyal to Ohio Health, I don't think that's the type of loyalty anymore. It's going to be a loyalty based on convenience and ease instead. But I am, no data. I like data. I like making statements based on data, but I really do feel intuitively that I think that's where that we are probably going to have to go as far as brand is concerned.
But jumping into this whole kind of theory of human coach and guide along the way, what if you intersected the two of those, right? So my health provider is aware of everything that's going on, that's being tracked by my iWatch or what's going on. And I think, and Nancy, I'm no MD, so feel free to squash this thought here, but it's the evolution of Western medicine. We have become a society of reactive medicine rather than proactive and early engagement medicine. And if we can get our health systems, our insurance companies to do better models, and then better physician practices to be on the proactive side of the patient, that means the patients they'll see will truly have acute causes, when the ether around that patient can help with the healthy behaviors and the daily check-ins, like my new map that checks in, and you check your weight and everything, you go forward. And Google's constantly having all this data with me, and Alexa's telling me to, hey, maybe the kids don't need to eat X, Y, or Z today, or whatever that might become. But that is all kind of taken care of. But instead of a physician saying, that's great, keep it up, the physician say, hey, I'm getting the feed from these apps in your life, and it looks like you're on a model for really good behavior change, or let's tweak it. That way we make the best use of that human coach, which is, in this case for healthcare, our physician, right?
So putting these two together, number one is I absolutely agree with Carrie that loyalty is going to shift, particularly in the less sick population, based on whoever makes it easy for me to get the care that I need. And with Amy, that the organization that puts my whole self together and integrates everything, and it's not just the person I go when I have to get my physical or have a sore throat. The organizations that do that first are going to lean toward getting that next wave of loyalty. And until organizations as a whole really start making that shift, there's going to be a whole period of lack of loyalty because nobody's filling those gaps and people are getting this taken care of piecemeal. Having said that, then you have to talk about segments of the population. Because what happens, you get cancer. God forbid you get cancer. And then all of a sudden everything goes out the window, and you want a health system that's really going to know how to take care of your cancer. And some of the annoyances of maybe they don't have the best ease to make an appointment, or they're not connected with my apps, but they're going to take care of my cancer. So I think today, a lot of organizations are still focused on the most sick population because that's where they do have the loyalty, and on the fringe, thinking about the next generation of the patient. And that's one of the reasons why they're not moving as fast, is they're still putting their money in the really, really sick, fee for service. These are the people who are our bread and butter. And we'll worry about the next generation later.
Ladies, I got the time nudge. This was awesome. I could talk to you like all afternoon. Thank you so much for your participation in this, as always. I feel like we hit on 3 new things this time around versus even last time around. So thanks for keeping it fresh for me. I really enjoyed it.
Absolutely. Thanks for having us, everybody.
Yeah, thank you for having us.
Our pleasure. Thanks for having us.
So I think, some of what we just heard really relates to this fundamental question of, how do we really understand the experience that healthcare consumers are going through today, and maybe start, imagining what the experience might be tomorrow. And so, over the past year, what Envera has been doing with, the folks you've just heard from, as well as others who are outside thinkers, leaders within the healthcare community, and a number of their own colleagues who are brilliant at what they do. Really, over this past year, it's been about collecting these stories, right? What are these experiences that healthcare consumers have, and how do they share those with us through stories? So, and that's really where we came into this process last year, is we helped gather some of the stories from a number of Envera's agents who work in their engagement center, who are really on the front lines of the patient, the consumer experience. They're talking to your consumers in some cases, as well as the consumers of other healthcare systems on a daily basis, and they do amazing work. And so we brought them together to really listen to and learn from the stories that they had and the stories that they could share with us, especially as it related to the consumer experience in healthcare. Now you might say, well, why stories? Why did you use that approach? And we use stories because stories are inherently human. They go back to time immemorial. And so one of the things we think a lot about at Share More Stories is the intersection of human and digital. And I love the things that we just talked about in terms of really taking advantage of all the amazing things we can do with technology to really improve the healthcare experience. And a part of that is also figuring out what's that core essence, the humanity that needs to remain present. The solutions that we were hearing in other industries, I would wager that in many cases it's because they really put the consumer, the human, at the center of that experience, and they built it around that. So maybe flipping this idea of brand loyalty on its head, how do we become loyal to the consumer need, to the consumer want? And so that's what we really did over the past year, was start to analyze those stories and experiences. We use a lot of tools that we've developed over time, and one of those is we leverage IBM Watson, as well as our in-person observations, to really understand the stories and understand what the values are that are being expressed by those consumers, what the needs are that they're expressing, and really what they care about at the most fundamental level. And so the stories that we've collected and the insights that we've generated with both the participants from today and the participants from the Truth Lab last year, we pulled all that together into the 2018 Truth Report. And so we're really excited to have partnered with Envera Health to develop that report for you. You'll hear more about that at the end of today's webinar in terms of how you can get access to that amazing, rich resource of insights to help you navigate the journey of transformation in your health system. What we wanted to do before we start thinking about what the next steps are is highlight for you a few of the key insights from the report. And so the first thing we want to talk about are really the key moments that matter in the healthcare system, or in the healthcare experience, I should say. And these are really moments to focus on. Whatever you do, think about these key moments. Start looking in your healthcare system today and say, hey, which of these things are we good at? Which of these things do we need to focus more on? Which of these things do we need to put humans back in the center of? And so we looked at these stories and experiences, and 5 key moments really emerged as we studied the healthcare experience. The first was access. So how do people come to find out? And we just heard some really great insight from Carrie about how people are discovering where they want to go to get care and how they want to get care. And so that whole access part of the experience is really, really key. So much happens in that moment. And then the next piece is when they actually start to proceed down that care experience. They come to a provider, they come to a facility, or they access that healthcare remotely. But that welcoming experience, transitioning from search and discovery to the beginning of the delivery of care, is another key moment that matters a lot in the healthcare experience for consumers. The third is really what most of you who are out there who are providers, this is what you really focus on every single day. And Nancy shared a lot of her insight on this. That's the expertise. We can't lose the expertise, because we're not coming to healthcare systems to get advice from amateurs. We need the pros who can really help us get better if we're sick, and in some cases, stay healthy. And then after that care is delivered, the final key moment, or the next 2 key moments, were really around transition and follow-up. And so this is when a person is starting to leave that experience. What does that moment look like? What does it look like when they're waiting in the waiting room for their family member to pick them up? And then when you're following up with them on the phone or an email, what is that experience like? What data are you able to access to make that call really personal and really relevant? These are also things that Envera Health thinks about and deals with, probably with the exception of the actual care delivery. These are things they're thinking about every day. But Jen, I want to turn it to you. When we think about the conversation we just had, when we think about these moments, one of the things that we discovered in this process were just how consumer focused these agents were. Tell me a little bit more about what that experience and that discovery was like for you as we thought about what they do in these key moments of healthcare delivery.
Yeah, well, the Envera agents primarily are working sort of in those that first step and sort of the latter steps.
Right.
What was remarkable truly is just how empathetic these agents are and how committed they are to making sure that people have a really good experience and get the information that they need. They see themselves as critical to the part of the care that these patients need. They view them as family, and they work as hard for these patients as they would if it were their own member of their family, whether it's, I think I have an appointment and I think it's with this group, and looking it up and realizing, no, you gave me the wrong name, but I did find your appointment and here it is, and I'll get you the directions and email that to you. I mean, just as if that's what was so remarkable, was I think just how much of themselves they were putting in these moments to make sure that folks had a quality experience.
There was a real sense of almost advocacy, like you said, as if they were their own family members, that they were caring for people that they were talking to really over the phone. Again, might be your consumers of care, but they were treating them as if they were their own loved ones. And this is what we mean when we say putting the consumer first, really making sure that that healthcare consumer is at the center of everything you're doing, that their experience is what you create as your experience. And I'll tell you that the agents at Envera do that exceptionally well. We called them empathy machines because their ability to really empathize with and understand what the needs were that consumers had at any moment in that experience was really, really key to a successful experience overall. And we think those are things that healthcare systems today should be looking at and thinking about is, how do we get better at these moments that really, really matter and shape or define the experience overall for their consumers. The next thing we started to uncover, the next sort of big insight, were identifying sort of, if those are the key moments, what are the keys to mastering those moments? And we heard, fundamentally through each of these stories and the experiences that the Envera agents shared with us, that there were really three key elements to engagement. You see them here. The first is listening. And that sounds so basic and so simple. And yet we all know that most of us don't listen as well as we could or should. But listening is absolutely crucial to delivering a superior healthcare experience for consumers. The second is building trust. And you've heard the old adage, right? Building trust takes a long time and it's hard, but losing it can happen in a snap. And so one of the things I think is so amazing at what the folks at Envera do is they are constantly seeking to build and reinforce trust at every step of the experience. In every one of those key moments that we talked about, they're building trust and they're doing it over the phone. And then the third is, at the end of the day, that consumer is looking for a result. They're looking for an outcome, whether they are being treated by a physician or whether they're calling to schedule an appointment or whether they're doing the type of search and discovery that Carrie discussed earlier. They're looking for a result. And so it's your job to make an impact in that part of the process. As they are seeking that outcome that they desire, how do you make sure they get it? That's the ultimate goal in that interaction and in that experience. That's how you master the moment. And so, Jen, I'll turn it back to you. When we think about the agents and the care experience overall, was there maybe a particular story you heard that sort of embodies these keys to mastering the moment?
Yeah, well, there were a lot of really good stories. I think that's why these things rose to the top.
Right.
The impression that I got that I remember so clearly, though, is how good the agents were at listening. And as James said, I'd like to think that I'm a pretty good listener, and that I also watch some body language for cues. But because these folks only have what they can hear through the phone, they've become really attuned to changes in breathing, a pause that might suggest hesitation, which might suggest something else, and it leads them to more questions that they ask. And I'll tell you, after listening to some of the agents for a second, it almost felt like for a while maybe I should walk around the world just working harder on listening because they were so attuned to it. But they also shared a story, another employee shared a story of sitting with a provider who was the 5th or 6th doctor that his father had been to see about issues that he was having. And the exact story was that the moment was how this physician was listening,
Yeah.
and really intently listening to what was being said, and immediately said, all these other things is not it. I know exactly what the issue was, and it changed everything. And oh, by the way, not just for that individual, but for the individual's family, because this was a family situation that they were all trying to deal with. So that really sort of left a mark for me as we were listening to all of these stories around care.
Well, that's interesting, because that really speaks to, again, sort of the human connection element of this whole process. And so, again, if you're in the business of providing care to consumers, how can, at each of those key moments, can we make that human connection? How can we look at them while we're talking to them and listen to them while they're answering us? I know we've got to fill out forms and capture that information that maybe we do 6 times, but even in that process, what are the cues and the signals that we can observe in that moment that allow us to even go deeper, to connect more clearly in a more lasting way with those consumers as they're going through, in some cases, some of the most challenging experiences of their lives? Which really brings us to the last big insight, which is all about needs. And what we heard was really fascinating and provocative. We do a needs analysis through the stories that people share, and we assess them on a number of different criteria, but these 4 needs really emerged as the driving needs that consumers have of the healthcare experience. And so you see structure and stability there, right? And that makes sense. People want their healthcare experience to be, established, predictable. There's some good process there. That doesn't surprise us that people want that out of their healthcare experiences. But what they also told us, and this is what really was surprising and delightful, to be honest, was that they want love and closeness. Now, when we discovered this, we were a little like, I wonder how that will play with folks who are really engaged day to day in providing care in the healthcare system. And when we shared these insights with the participants at the Truth Lab in June, to a person, they were like, that's exactly what my healthcare system needs to do more of. And so we had a lot of great dialogue and brainstorming about, how can we do more of that? How can we make more room for love and closeness in the healthcare experience? It doesn't have to be squishy. It can be, the look in the eyes. It can be the basic compassion when somebody's going through something difficult. It can be coming out into the waiting room and giving somebody a blanket just because they need one. All the expertise in the world is great and absolutely critical, but adding that human element to the expertise, to all the touch points, really can make the experience overwhelmingly positive for the consumers, even when it's a difficult situation. And we heard some of those stories too. And so I think what I'd ask you as we wrap up this piece of the conversation is, when you thought about that human aspect, and you thought about love and closeness in particular, what surprised you about that, or what stood out to you in that part of the conversation?
Well, what stood out, and I'm going to anchor a little bit back to what we had just heard from Amy as she's pushing for this, when are there times when you just need human moments? Agree with you, structure and stability, that makes a lot of sense. That's the place where a lot of technology can help streamline things, make things more efficient, predictable, regular. The shocker from this analysis and that we did was, it's not just the patient or the consumer that needs love and closeness. The providers and the caregivers need and want to give that. It's part of the reason that they're working in this space. Right. And the symbiosis of that desire for human connection, particularly in healthcare, is really exciting for me. And I think that's what is being yearned for on both sides. Yeah. As I think about the people I know that are physicians or in the health system, their frustration, their sadness is coming from the gap that they currently feel between the reality that they're in and what they would like, which is time for a little more human connection and to give this sense of love and closeness to people that they know need it.
Well, on that note, I'll reiterate what you just said, because I think it's powerful and it connects to something Carrie said earlier as well, which is, this doesn't mean to say that we don't want or need the technology. We absolutely do. There's huge opportunities to take better advantage of technology, and Carrie gave us some great examples of this, as did Amy. I also think that, as Nancy shared, that expertise, which is delivered through a human experience, is absolutely crucial. And so what we'd leave you with is, it's actually a balance, right? And it's bringing both of these sides, to the human and the digital, and delivering that in a way that makes sense, not only for your healthcare system, but really makes sense for your consumer, because putting the consumer first is the only way that healthcare in general can continue to improve, and that, to Carrie's point, you can find some way of navigating this really, really challenging time ahead of you, where competitors and new entrants are coming in at a rapid pace. Finding your footing and finding the place where you can deliver that experience as only you can, but do it with a combination of meeting these needs. Take advantage of the best technologies you can, but really focus on that human connection and experience. Because I agree with you, Jen. Folks are yearning for that. And so what we're going to do now is turn it back over to Erin, because I think she wants to kind of bring this back for all of us and help us make this connection around putting the consumer first. So thank you.
James, Jen, thank you so much. That was an absolutely wonderful bow on this session today. And, especially thank you to our participants, Nancy, Carrie, Amy. They were very engaging for us last summer when we had them here in the first Truth Lab, and absolutely engaging today in what is sometimes a complex way of delivering messages on a panel in a technology-enabled way. So a very, very special thank you to them. From my perspective and what I heard today, I've spent a majority of my career on the provider side, inside those walls, as Nancy talked about, really trying to understand how can we better connect with ourselves, how can we better connect with each other and our consumers to deliver a better experience. And so much of what I heard from the outside industry experts that we brought today were so many of those puzzle pieces that so many of us throughout the industry were trying to solve. And now on the outside of inside the industry, but on the outside of the provider side, what I get to be blessed with every single day is engaging with so many of our provider partners and our friends in the industry, and helping them resolve some of the issues of these puzzles, some of these puzzle pieces that we're all trying to put together to make this a more consumer-oriented industry overall. So some of the things I heard today from our experts, and certainly I learned something every single day when I engage with both our providers and our experts. But on the retail side, what Nancy talked about was accessibility and designing around the consumer demand. And it's the consumers demanding it, and really designing something that is accessible for them and at the ready. And when she talked about being open in the holidays, Christmas and New Year's, and I thought it was incredibly entertaining when we heard her talk about the parking lots and what they learned about that, and sort of the behaviors that we as health systems have that is absolutely the opposite of what the consumers are actually desiring. What we heard from Google and Carrie, and understanding a consumer journey, really starting with search. That we have a lot of the data, I would say, but we don't use it as providers as well as we probably can. And for a lot of reasons that can be a barrier or burden for us as providers to establish more consumer orientation. And then finally, in financial services, or even generally from Amy, what she learns every single day, and talking to industries across the country, is really how nudge behaviors. So it's the smaller steps, the simpler things that we could start doing to help orient ourselves around more of what a consumer desires and what they need, as well as to bring them into a space of wellness. So for all three of them, and those were just small pieces of this wonderful conversation that they shared with us today, that I took away from that dialogue. And then finally, the partnership model. And probably one of the most impactful stories today for me was what Carrie was describing, and that was how inside of the walls of the health system and what they were doing, for example, at Ohio Health and that team, and orienting themselves around a consumer desire, really, to live a healthier life but need a little help around doing that was wonderful. So all of the learnings were fantastic today. I do want to thank everyone for joining the final portion of this session of the Truth Report that was shared with you. I'm excited to have the first Truth Report shared with all of you, which will be sent to all of you at the completion of the webinar. And certainly, we also want and desire to have all of you, if you'd like to participate in person at this year's Truth Lab here at Envera Health, we invite, welcome, and would love to have you participate. So with that, I'm going to conclude the webinar. I'm going to thank everyone that was participating. And with one word, I will say that we're all trying to desire a more easy experience for consumers and consumer engagement in our healthcare system. Take care and have a great weekend, everybody.